Hi, everyone. Thanks for tuning in. We're joined live today by David Luzzi, Senior Vice Provost for Research at Northeastern. Today, we're not talking about research, we're talking about reopening. David has led our efforts to prepare for your return, and he'll explore our on-campus testing infrastructure, which is a major investment made by the university. David, what is this robust testing effort and why is it so important?
Thank you, Riley. So testing is, of course, I think everybody can see it out in the news, out in the literature, that testing is a major component to safely running society in the presence of a pandemic like COVID-19. And we very early on knew that if we were going to be safely operating the campus, that we would have to have a robust testing enterprise. And we have looked at and continue to watch all of the technologies and all of the different types of testing. Now, there's multiple types of testing, and you might have heard of some of them. So there's viral testing. That is a test to see if somebody actually has the active virus in their body. And there's serological testing, which is to test whether somebody has the antibodies to the virus in their body. That means they have already had the virus, they've recovered, and now they have the antibodies in their body. Okay. There are multiple factors that you have to consider when you consider testing. The accuracy of the test, the technology you use, et cetera, et cetera. So we made a decision that the correct way, and this is the way that's being applied at all universities, at all of the major testing centers like Quest and LabCorp around the nation, at all of the hospitals, et cetera, is to use the gold standard of testing, which is PCR, or polymerase chain reaction, testing of the genome of the virus. So we are looking for the presence of the RNA, because viruses have RNA. And what we do is we transcript that RNA into DNA, and we look at the DNA to prove that the virus is present or to prove that the virus is absent in a sample. Now, polymerase chain reaction is the same technology that was used for the Human Genome Project, the project that actually characterized the genetic makeup of us. That was a huge program of the federal government for over a decade. Many new technologies came out about that, including Northeastern University Research was a big contributor to that back in the day. So that is the technology that we use. We have built a testing center, and I can get into as much detail as people want, but we've built a testing center with a capacity of 5,000 tests a day. That means we can test a large fraction of our population every day, and therefore we can not only run a frequent testing regimen where we can know the health status of our community on a continuous basis in the fall, but if we need to, we can even accelerate that testing strategy as facts on the ground require. So that is the technology behind the testing.
Can you speak a little bit more to the general scale of this effort and how we're leading the way?
Sure. So Northeastern is one of the leading universities in the world in terms of modeling of epidemics and pandemics. We have a world famous network science institute that looks at the spread of disease as one of the core themes in terms of what this institute studies. It also looks at, for example, the networks that happen within a body, within a cell, within social media, and how it influences elections, et cetera. But for the pandemic, the Network Science Institute has been involved for a long time in developing the models to successfully model how things spread in a networked world. So if you want to think back to the dark ages when there was the bubonic plague and Black Death, that spread because towns interacted with each other. It spread from Asia across the Eurasian continent and ended in Scandinavia. And we know exactly how fast it spread. It spread 4 kilometers a day for the entire time that terrible pandemic went through the world's population. In a networked world where people are flying to different places, et cetera, the spread of disease is different. And that is what we have been at the lead in. So the Center for Disease Control, the World Health Organization, the White House Task Force, state governments, city governments, et cetera, depend upon modeling out of Northeastern University. And the other 4 universities are University of Washington, Harvard University, Columbia University, and Imperial College in London. Those are the big 5 institutions with Northeastern that does this modeling for these world-spanning organizations. So we have applied that capability inside Northeastern also to model how we can approach testing and keeping the community safe in the fall semester. There are 3 pillars, of which testing is one. The other 2 pillars are face masks. Face masks make a big difference in terms of increasing the safety posture of a community. So we have a big campaign. We are requiring that people wear face masks on campus, except where obviously you can't wear a face mask. When you're eating, obviously you need to have your face mask off. So, but we will have that as a second pillar in terms of keeping the campus safe. And the third pillar is daily health check. That is, there's going to be an app. That app will be available for every student, faculty, and staff member. And every day, it's a very quick thing to do, but every day, everybody is required to check in and feed in about their health status. If they are feeling healthy, they get a green screen, good to go, come back to campus. If they are not feeling healthy, if they have any symptoms, then for all the students, they have an immediate touch on their screen that connects them to the University Health Center. The University Health Center will have a health professional intervene with that student, interview that student about how they're feeling, and make a decision about what the prognosis and what the strategy should be for that student. Now, one of the things is, if any of those symptoms are consistent with the symptoms of COVID-19, that student would be immediately directed to come into a testing center, not the general testing center that's testing the whole population, but a specific separate testing center that we have set up on campus for symptomatic people to come in and get tested. The key is they will be taken out of cycle and immediately tested, because our modeling says the faster you can intervene and find who may be infected with the virus, the faster you are able to, first of all, have a medical intervention for them, which is very positive, but also have a intervention that keeps the infection from spreading on the campus. So these are the 3 fundamental pillars of how we are going about the fall semester: pervasive testing, face mask wearing, daily health check with immediate intervention for symptomatic folks.
David, Northeastern will provide testing for all of our community members. We have a live question from a viewer who asks, how specifically will off-campus students be tested?
Off-campus students, and of course employees are by definition off-campus. We don't have, well, we actually do have a very few faculty that live on campus, but the vast majority of our faculty and staff live off-campus. Off-campus students, the same thing. Everybody will be part of this testing regimen. Everybody will be required to do the daily health check. Everybody will be required to wear face masks when they are on campus and in classrooms, etc. So in that sense, there is really no difference between those living off campus and those living on campus.
Thank you. So let's say I've just arrived on campus, or you've just spoken a little bit about what this might look like for faculty, staff, and on-campus students. Where do I go to get my test?
Right. So we have actually converted one of the larger gymnasiums on campus, which the students will know as Cabot Cage. Probably a terrible name for a building, but anyway, that's what everybody calls it. And that is going to be the main testing center for asymptomatic. That means people who are not showing any symptoms. And at the entrance to Cabot Cage, there will be health monitoring in terms of temperature check with the infrared off the forehead and verbal screening. How are you feeling? That type of thing. Students, employees, etc., will enter the testing facility. Everybody will maintain healthy distancing, which, by the way, is healthy distancing requirement for people who are not wearing face masks. But in addition to that, people will be wearing face masks. So it's healthy distancing for the riskiest behavior, but not with risky behavior. So even safer than CDC guidelines. There's plenty of room in there to maintain healthy distancing. We are building up a scale of operation that we will be able to process people through the testing center very quickly. So the key here is, we have kind of two parameters that we are constantly considering as we think about the fall. And it's, people may laugh a little bit about these names, but we have two one-syllable words. One is safe, the other is joy. Okay, so if you think about an axis, safe and joy, we want to be in the upper right, which is high safety, high joy. And we recognize that testing is very important for safety on the campus, keeping the community safe. At the same time, nobody wants to have testing taking up a big chunk of their day, which is why we are building up the process to not only process people through very quickly, so it's a minor interruption in their day, but also to process these tests very quickly, so people will be going on through their day, but people will get their results very quickly, as fast as can be done with PCR response.
Our community members will be tested with what's called an anterior nasal swab.
Yeah.
Can you speak to how this test might differ from others that we might have heard about? What sets it apart?
Yep, absolutely, Briley, thank you. So anterior nares swabs, which are also called frontal nasal swabs, are the ones that actually only go a short distance into the nose. So the famous ones, the nasopharyngeal swabs are the long ones that get shoved up. People, horrible way to say it, but people call it the swabs that tickle your brain. I mean, that's a horrible way to say it, but they are uncomfortable. Those were the swabs that were first used back in the spring, and places that are still doing that is because they're using up their stock of these long swabs. The ones that we are doing and the ones that we've already been doing on campus in the summer as we build up and run trials are all the frontal nasal swabs. So, and we're going to be doing observed testing. That means students will, if we're talking about students, of course, faculty and staff will be the same. They will come into the testing center. They will get a swab in a vial with a barcode that is unique to them. Of course, they will register. So they are registered in the system, in the laboratory information management system. They will go to their testing location in the gym. They will stand there. There's a health professional in front of them who will instruct them, which in the beginning will take a little bit longer. Once people have been through their third or fourth or fifth testing, they are going to be professionals at it. But they will then be instructed how to do it themselves. And these are, this is the standard out there, standard of care now in the field. It works very well, and that's been proven. They will swab themselves. They'll put it in the vial, close the vial, hand it to the health professional. It'll go off to the lab. They will exit the gymnasium, and they'll go on with their day. That is the process. So it's a non-invasive, so very in the front of the nose. No, I've done it. It is really not really disruptive at all in terms of discomfort or anything like that.
You mentioned that these tests are really fast and not disruptive to our schedules either. How long does the testing process take, and how long do we wait for our results?
Right. So the testing process should just be a few minutes. And we anticipate that, as our population gets more professional about testing themselves, it'll get even shorter. But, there will be, it's all set up. So you'll come in with your ID card. All your ID cards are Prox cards. So instead of having to manually enter your information, you will come up to the registration desk. You will touch, or whatever you do with the Prox card, hold it against the RFID reader. It will populate the screen. You will be shown the screen to confirm that, yes, that's you, that's your information. Meanwhile, while you're looking at the screen, the printer will be printing out the barcode that is unique to you, that gets put on the vial. You will receive that vial for your test. The vial kit you'll receive that kit. It contains a vial and a swab, and you will go then to your station. You will then be led through your swabbing process, the actual taking the test, and you'll leave, and then you'll leave. So we anticipate that really literally just being a few minutes. Now, the test result, if the tests are done with an exterior lab, the ones out in the world, the professional ones, are really struggling these days. So they're talking about 5 to 7 day turnaround. We actually have access to an exterior testing capability through the Broad Institute, which is a famous research institute in the Boston area in Cambridge. They promise turnarounds in 24 hours. But as I said before, our prime testing facility is our own testing facility that we have built, where we are anticipating we'll be able to deliver 6-hour turnaround. And one of the reasons why we were able to build this is because we are a research R1 university that was active in the Human Genome Project. So actually, spinning up a testing lab like this was not a hard thing for us because we have all of the expertise. It was literally just bringing on enough employees and training them to actually do the processing. But in terms of building the facility, in terms of running the facility, we have all the expertise at the university already.
We have another live question for you, David. Our viewer writes, the Massachusetts governor has just issued an executive order with respect to travelers who are coming from out of state. I know that the university will be making specific decisions to be announced soon. Can you speak to the connection between testing and quarantine?
Absolutely. So let's recognize that there's two dimensions to quarantine. Okay. Number one is the travel to Massachusetts. Okay, that's the famous one. You know, you quarantine for 14 days. It's up on the signs on the highway, etc. The second aspect of quarantine is quarantining of people who are found to be close contacts of people who are found to be sick with COVID-19. Okay, I am talking about the first one, which is the travel quarantine right now. So Massachusetts indeed came out this morning. We have, we were in the conversation. We have been in constant conversation with the Department of Public Health at the state level, with the Boston Public Health Authority. We have students that live outside of Boston. We are in constant communication with the public health authorities of every town in which our students live outside of Boston. You might imagine, if you are a PhD student or if you are a family member of a PhD student, our PhD students live in Somerville and Everett and Malden. So we are in communication with all those public health authorities. So the new travel rules out of Massachusetts are that you have to be tested within 72 hours of coming to Massachusetts. That means where you are, you have to test 72 hours before you come to avoid quarantining. Well, tested with a negative result. The language is a little bit ambiguous, so we have gone back to the state because we want to know, are they saying that you must be tested? That means the test must be administered within 72 hours, or must you get the results back within 72 hours? Those are two very different things. And of course, given the way testing is going on in the nation, those are somewhat hard things to meet if it's chosen one way or another. The state has ruled that those tests must be PCR tests. That is the gold standard. That is the test that we are using, the genomic-based test for virus that we are using in our testing center. The state has said, for educational institutions, people can come in and be tested immediately upon arrival or shortly after arrival, or they have to quarantine until they are tested. And if they have a negative test result, they are released from quarantine. Okay, so that is part of the state rule today. So that eliminates the 14-day quarantine. Because we have this robust testing facility on testing capability on campus that will be spun up and operating by the time anybody arrives, we will be implementing that approach right away. One more aspect of the state rule. If you are moving in to an educational institution, you can do that pre-quarantine. That's kind of like the catch-22, right? To avoid the catch-22. If you are a parent, you are allowed to help your student move in and then immediately depart. And that is possible without having to do quarantine or doing having a negative test result. Now, if you have the negative test result, you don't have to worry about those things. Okay, so we are moving to get testing done right away when somebody comes on campus, and then doing the very fast turnaround in results to release them. Obviously, if they test positive, they would go into isolation, and we have that whole system set up. We have reserved 550 beds in dorms. We have reserved that, isolated from other things, for anybody that tests positive, where students will have their own bathroom, their own concierge, 3 meals a day process. They will get access to our new flexed way of teaching so they can keep up with their coursework, et cetera, for anybody who tests positive. But we have that all built into the system. So we are doing that, all compliant with the test rules from the state that have come out today. We are ready to go.
Sounds good. Another viewer asks, David, what if you've been tested and have the antibodies? Can you speak to the viability of those antibody tests we hear about so much?
So right now, the public health guidance. So this is the challenge that we have with serological testing. So testing for the antibodies is called serological testing, and there's really 3 antibodies that are tested for: IgG, IgM, and IgA in the body. IgG is the most indicative of immunity to COVID-19. However, the science of how long that immunity lasts is still evolving. So the university is at this point under the policy that we are not accepting serological test results to allow any different behavior on campus. That is daily health check, face masks, complying with the testing regimen for virus. We are also monitoring the science as it comes along, as well as the public health guidelines. Remember, Northeastern is an advisory organization to the Center for Disease Control, and the public health guidelines for the United States come primarily out of the Center for Disease Control. So when we look at serological testing, let me give a little bit of statistics information here. Let's say that 5% of the population is sick, and let's say that the serological test is 95% accurate. That means 5% of the time, 1 out of every 20 tests only, gives a positive, yes, you have the antibodies, even though you don't. Okay, that's the definition of sensitivity for a serological test. So if we have 5% of the population who are truly immune, that means they have the antibodies, then let's say the test finds all of them. Okay, that means 50 out of 1,000 people are truly negative. Now, we have 950 people that don't have the antibodies, but 5% of those are going to have a false positive result. 5% of 950 is a big number. It's almost 50. So now you have 50 people who are truly positive and get a positive result, but you also have about 50 people that are not immune and got a positive result. So if the prevalence in the population is 5%, then you have a 50-50 shot of knowing whether somebody who has a positive result from a serological test is truly immune to the virus. Okay, so that is another reason that's driving the university's decision not to allow serological testing to get people released from the expected 3 pillars that we are requiring: daily health check, face masks, testing.
Looks like we have time for one more question, David. What plans are in place after a positive test result, whether for the community member who tests positive or for those that they may have come in contact with?
Right. So in every state, there's a legal requirement that every positive test gets communicated to the local public health authority. So that will happen. Northeastern's testing facility is certified by the state, registered with CLIA certification with the Food and Drug Administration. So we have all the certifications. We are a testing facility that can test anybody for this virus. Okay, we are applying this to our students, faculty, and staff for 2 reasons: quicker turnaround. I said the 6-hour turnaround is what we want, but also we do not want to be a burden on the national system. The national system is struggling to spin up testing, and we don't want to say, hey, we're dumping a demand for 5,000 tests a day on the national system. So that is why we spun up our own facility. Okay, so with that, in mind, then let's say somebody tests positive. Out to the public health authorities, yes. Public health authorities will institute close contacting. We will contact that student for medical intervention. We will, assuming it's a student, obviously the same thing for employees and for faculty and staff. For students, they will go into isolation, right? Where do they live? Or if they're in a dormitory, they will be moved into special isolation dorm rooms for that student. The close contacts will be identified through interviewing with that student, and then those close contacts will be instructed to go into quarantine. For the close contacts, we have an accelerated test regimen. That way, I mean, we don't have time right now, but I can walk you through the progression of what COVID-19 is in the human body. You're infected on day 0, when you become contagious, when you start showing symptoms, although a lot of young people are asymptomatic, they never show symptoms, when the virus load in your body peaks, and when you recover, okay? So we know that progression, and therefore we can test at points along that and find out, you know, the standard we're using right now is test a close contact immediately. Any close contact that is tested gets right into testing. Any close contact that is identified goes right into testing. And then day 3 and day 5, we will test, or day 3 and day 6, we will test those students again. As soon as they have a double negative, that student will be released from quarantining as long as the public health authorities agree to this regimen. That is still a conversation going on with the public health authorities. But as soon as we get an agreement with the public health authorities how to bring our testing regimen into how we handle close contacts and quarantining, we will announce that policy as the policy for the university, and that's the way we'll run the fall semester.
Well, we've covered a lot today. For our viewers, you'll find answers to these and many other questions on our reopening website. That's news.northeastern.edu/coronavirus. And be sure to check your email boxes for additional information about upcoming town halls for more questions. Thanks so much for your time today, David. We appreciate it.
Yes, and we're looking forward to welcoming everybody back to a campus that is ready for you in the face of COVID-19. See you in September.